Welcome back. Let's talk about your healthy living. So during allergy season, many of us turn to nasal sprays for relief. And now there's a little bit of new data that found a common nasal spray for allergies could help prevent COVID-19. That's right. Dr. Eric Griggs joins us to talk about this nasal spray that's called what?
Zelastine.
Thank you. And whether it's a possible option when COVID cases start to rise. This is why you're the doctor. Please tell us what you think.
So you might have heard of Zelastine. It's a prescription your doctor might write for you called Astelin. So
Okay.
it's a antihistamine over the counter. It's called Astapro.
Okay.
What they found was that 450 people, they were all healthy. They gave placebo and Zelastine. I can't remember whether it was twice or 3 times a day. And they noticed that the rate of COVID infection and the rate of the rhinovirus or common cold infection was significantly lower,
Now, you already know this because you recommend this to the general public, to your patients, when somebody comes in and says, I'm not feeling so great. You like the nasal sprays to stop it from getting into your chest, is that right?
So if you look at they call it a respiratory tree for a reason. If you turn the tree upside down and start at your windpipe or trachea, it branches off the bronchi, the bronchioles, the alveoli, but it all starts here above the tree in the nasopharynx or your oral cavity in your nose and mouth. So the theory is that if you're able to put a spray in and block those viruses, along with the hair, the natural protections, the washing of hands, the whole nine, block those viruses from getting in, you potentially can keep the viral load small enough that you don't get infected, and most importantly, it doesn't get down into your lungs and can cause pneumonia.
So, but this particular spray is created to prevent or to treat these particular viruses, or would you get that kind of coverage with any nasal spray?
This has been around for a while. It helps to decrease the size of your mucosa or the swelling in your mucosa so you can actually breathe and make you more comfortable. But they found that it possibly blocks. And I say possibly because this is a phase 2 clinical trial.
And you don't believe them until they're in phase 3.
Phase 3, and they've been in larger numbers when they go to scale, and then it's been peer reviewed through the entire peer review process, which sometimes feels like has been thrown out the window because in the medical community, in the scientific community, we're really hard on each other. Before you say this to the general public, do you have the data, and did you look at this, did you look at this? And it has to do with the strength. It's called the strength of the study, and there are certain metrics that have to be met. So this is promising.
Okay.
It's definitely something you can talk to your doctor about if you don't mind using nasal sprays, but I wouldn't bet the bank on it yet until there's more data that comes out. But it's good, it's promising. You
wouldn't replace getting the shot at this point, knowing the difficulties that are coming with getting the shot at this point, the COVID vaccine?
If you are a person that would like to get the COVID vaccine, I'm COVID vaccine pro vaccine. But if you decide to get the COVID vaccine, have that conversation with your doctor to find out exactly where and the logistics that go along with it, because the numbers are surging in different parts of the country now, and we're moving into cold and flu and respiratory virus season. So everything we can do to protect ourselves, be it the nasal spray, washing our hands, the masks, when you feel, don't go out when you feel sick, taking the vaccines, all those things work. But have those serious conversations and ask. You can ask about this new study.
Okay, doesn't hurt. Thank you so much, Dr. Griggs.